The topic is L-arginine. L-arginine is a amino acid found naturally in red meat, poultry, fish, and dairy. It's needed to make protein and is commonly used for circulation. L-arginine is converted in the body to chemical called nitric oxide. Nitric oxide causes blood vessels to open more to improve blood flow. It also stimulates the release of growth hormone, insulin, and other substrates in the body. It can be made in a laboratory and used in supplements. People use L-arginine for chest pain and various shock flow problems, erectile dysfunction, high blood pressure during pregnancy, and a serious condition in premature babies called necrotic enterocolitis. It's also used for many other conditions, but there is no good scientific evidence to support this other use. For example, possible effective for chest pain, angina. L-arginine intake appears to decrease symptoms and improve exercise tolerance and quality of life in people with angina, but it doesn't seem to help with the blood vessels that narrow in angina. Erectile dysfunction. Um, a daily intake of 2 to 5 grams of L-arginine seems to improve sexual function in people with erectile dysfunction. Taking L-arginine, which drugs like sildenafil and tadalafil might work better than taking L-arginine or the drug alone. High blood pressure. Taking L-arginine by mouth can lower blood pressure in healthy people, people with high blood pressure, and people with middle high blood pressure which are without diabetes. A severe intestinal disease in premature babies. Adding L-arginine to the formula appears to reduce the risks of the condition in premature babies. Narrowing of the blood vessels causing for blood to the extremities. Taking L-arginine by mouth of intravenously for up to 8 weeks increases blood flow in people with this condition, but using it for up to 6 months doesn't help improve walking speed or distance. Intravenous products can only be administered via Alcantara provider. A pregnancy complication characterized by high blood pressure and protein in the urine. Taking L-arginine intravenously can lower blood pressure in pregnant people with preeclampsia. L-arginine might also reduce the risk of preeclampsia in people who are at high risk for this condition. Intravenous product can only be administered by a healthcare provider. It's not it isn't clear if taking L-arginine helps. High blood pressure during pregnancy. Taking L-arginine intravenously can lower blood pressure during pregnancy. It's not clear if taking L-arginine lowers blood pressure during pregnancy, but it might decrease the need for blood pressure lowering medication. Intravenous products can only be administered by a healthcare provider. A possible ineffective form. Long-term kidney disease. Taking L-arginine by mode of intravenously does not improve kidney function in most people, which high cholesterol. The intake of L-arginine does not help to reduce cholesterol levels. Myocardial infarction. Taking L-arginine by mouth doesn't seem to help prevent a heart attack. It also doesn't seem to help treat a heart attack after it happens. In fact, there is concern that L-arginine could be harmful to people after a recent heart attack. Don't take L-arginine if you have had a recent heart attack. Tuberculosis. Take L-arginine along with standard tuberculosis treatment doesn't seem to help improve symptoms or clear up the infection. Wound healing. Taking L-arginine doesn't seem to improve wound healing. When taken by mouth, L-arginine is possible safe for most people when taken short term. It can cause some side effects like stomach pain, bloating, diarrhea, and low blood pressure. When applied to the skin, L-arginine is possible safe for most people when used short term. It may also be safe when used in a short-term toothpaste. When inhaled, L-arginine is possible safe for most people when used short-term. Special warnings and precaution. Pregnancy L-arginine is possible safe when taken by mouth for a short time during pregnancy. Not enough is known about the long-term use of L-arginine during pregnancy. Stay on the safe side and avoid prolonged use. Breastfeeding. There is no reliable information to know if L-arginine is safe to use while breastfeeding. Stay on the safe side and avoid using it. And children. L-arginine is possible safe in children when taken by mouth, when used in toothpaste, or when inhaled. One recent heart attack. L-arginine might increase the risk of death after a heart attack, especially in older people. If you have recently had a heart attack, don't take L-arginine.